I've had my flu jab last week. I still feel good. That's good. I did a 10k race on Saturday after I had my flu jab on Friday, so absolutely safe. And please do it. Really important for our patients, our staff, your families, and everybody else. Just to remind you, this is about us. It's about us. You probably can't see much of that, but this is something from our annual report. It's us on a page. It's a little bit about our vision. It's about patients being at the heart of everything we do. It's about us being a values-based organisation and living those values. And it's also about our 4 key objectives: about quality, about working in partnership with others, about our staff and about you, and about sustainability, about our money and our quality. So that's just a little bit about us. It's useful. Hopefully you'll see it around the organisation coming up. So what's happening? Sustainability and transformation plans. Because actually we've not been allowed to share our sustainability and transformation plans as yet. They've got to be submitted on the 20-something of October, after which I hope we will be able to share them much more significantly. What are they about? They're about creating a sustainable system, a sustainable health and care system in the UK. I'll come on to that, but we have to live within our means, within reason. And so we need a plan to make sure we live within our means, because, as we know, the population is ageing, there are more of us, we are living longer with complex conditions which require more care. So the cost of the NHS goes up. Money is generally pretty flat, a little bit extra at the moment, but it's only like 1% a year or something of that order. So we need a plan that in 5 years' time we'll be living within our means. And so every system in the UK, and LLR is a system working together. Every system has got to produce a plan which says in 5 years' time we will be living within our means. So what's the key themes that we're going to do it by? They're up there. Integration, by far and away possibly the most important. How are we going to work across organisational boundaries? How are we going to work across our own organisational boundaries? How are we going to make our care as effective as possible, that every contact we have with someone adds value to that person, adds value to their health, works on prevention, works on health promotion, works on the management of long-term conditions. How do we avoid hospital admission? So we need 15% less admissions to hospital in order to create that sustainable future. And last year it was 8% up. So not only have we got to turn off a rise, we've got to reduce it down by 15%. We'll do it by talking to each other. We'll do it by managing long-term conditions much better. We'll do it by not having handoffs. We'll do it by much more integrated, team-based working. We'll do it by having a really resilient primary care sector with a growth in the number of people working in GPs and primary care. We'll do it through effective leadership. So what are we doing locally? Well, we have our Better Care Together programme. That's about describing the way in which we work together. It will be the way in which we deliver our sustainability and transformation plan. And we will be working towards a consultation that will probably be in January or February now, looking at some of the impact of things that are on the first slide. What does acute hospital reconfiguration look like? Where will the beds be in the system? How will we have to do things differently, which require public consultation? And that will be early in the new year. But we also want to strengthen the governance, the ability of the system to make a decision. We can make a decision. I can make a decision on behalf of LPT. How do we make a decision across 5, 6, 7 organisations? How do we make a decision between the local authorities and the CCGs and UHL and us, all of which might have different implications on us? So we're strengthening and talking about how we do that through a committee structure with all the chief officers sitting in it to make combined decisions which are for the good of the system, not necessarily for the good of each individual organisation, and that's the challenge we face. Workforce. So, will we have the workforce to deliver all these changes? So, a big focus on describing the workforce that we need. And thank you to the team that have been working on this. A part of the submission, this STP submission, is actually trying to describe what is the workforce that we need in 5 years to deliver these changes. How will you be different in 5 years' time working in integrated teams? How will you be different in terms of your skill set? How will we work across that health and social care divide? How will we have skills which don't require 2 people going out but 1 person going? How will we might have more doctors now, but how will we manage this when there aren't as many doctors and that we need more advanced practitioners? So we're working on that as we speak. And of course there are system financial challenges. We all know that UHL has been in significant financial difficulties, and we've got to change that. We've got to move that on as a system. It's not just UHL's problem, it's also our problem. And so as a system, we need to get the system back into financial balance. And financial sustainability, we need to be financially sustainable. Last year, we had a £1.6 million financial surplus, which is great, so well done to everybody that managed to live within their means and develop that surplus. Really important that we do that, because that money can then be invested into our capital programs for our buildings and our computers and things like that. But again, it's a challenging year this year, and we need to focus on delivery of another 1.6 million surplus this year. We're over halfway through the year, and we need to continue to focus on how we're going to get to the end of the year. Performance is good, well done to everybody. We've reduced waiting times across services, but there are challenges. We know there are challenges, most sitting right in front of me. I can't help but not mention that out of mental health pathway, which is too busy, it's too hot, there are too many people coming through it, we're too full. We've got, I don't know how many people out of county, Rachel, today? 17, 18, 19?
It's slightly less than that.
Slightly less than that, okay. But too many people out of county, that's not good from a financial perspective, it's certainly not good from a quality perspective, it's not good from a patient experience perspective. So we've got to work to get that pathway delivered in our means. Well done on CAMS, Helen, the team, well done. It really is, we have seen significant improvements, and there will be more improvements. If I stood up here this time last year, there probably would have been 100 children, 250 children waiting over 13 weeks. And many of those waiting over 40 weeks for an appointment. If you're a 7-year-old with a mental health problem, you do not want to wait the best part of the year for an appointment. As of today, how many people are waiting over 13 weeks? None. Well done. And it's a significant challenge to the teams. I know you're going to have to work very differently. Brilliant. Well done. But we've got a CQC visit coming. Week commencing the 14th of November. Should be ingrained in my memory. So I'm just going to talk 2 minutes about. They came last March. Yeah, March 15th, wasn't it? They found that we were caring. They found that we were effectively working in multidisciplinary teams. They thought our incident reporting systems were good. They complimented us on our safeguarding. But they also felt there were improvements that needed about seclusion and restraint and some of the environmental risks on some of our wards. The fact that we didn't always consistently apply the Mental Health Act to the paperwork associated with it, or that we were aware of capacity, the way the wards connected to the board, and did the board understand the risks that people were managing, and how people were engaged in what we were trying to achieve. So we got to require some improvement. I think that was fair. They're back with us. I think 80 inspectors are visiting us. There were 105 last time, so it's less this time. Only 80 for a week, of which 60-ish are going to be mental health inspectors. So you can tell what their focus of their visit is going to be. So there'll be 20 for other services, 60 for mental health. So we should prepare for that. Of course, all the directorates have mental health services, so it could be accounts, it could be older people services, and it also definitely have mental health and learning disability services. We've been working really hard. You have been working really hard over the past 18 months to improve on things since that time. I don't want to talk about all of these, but we have improved our medicines management. We have reduced many of our waiting times. They commented on the CAMS waiting time when they came last time. Hopefully we'll see those improvements. We have improved many of our environments around ligatures, and there's building work still ongoing, I think, in Herschel Prince to improve those environments. Wow, what a difference in things like mandatory training we've seen over the last year. People have made a real commitment to deliver that, but again, those are things they noticed last time, which we will see improvement. We have improved the Mental Health Act paperwork and compliance, and that's been noted in visits by the CQC over the past 18 months. We've moved to electronic patient records, we've increased access to psychological therapists. They still keep coming to CQC, they come to the Mental Health Act visits, as we know, and then they use that intelligence when they come back to do their full compliance visits. So what have they found? Well, we're still sometimes we're not as good as we need to be in some of our filling in of the relevant forms and consent to treatments, and so we still need to focus on that. We're working on bringing that into the electronic patient record as well, and people will have noticed that some of those forms are now part of the sort of mandatory fields as you go through the RIO system. There has been changes in the guidance on ligature management, we need to be aware of that. But there's also all the things that's been in the literature about learning and learning from deaths. And I think we should anticipate that we will be asked around that. How have you learned? And it's a very good question they'd like to ask of people. CQC like to ask, what's changed? What have you changed in your practice as a result of something that's happened, an incident that's happened in a different part of the trust? What's changed in your environment where you work? And again, that's a really important question to sort of just begin to ask yourself, well, what has changed over the last 18 months? What is different? We are a values-based trust. I want you to behave in a values-driven way. And we do need to develop integrated healthcare. We can't do this on our own. One of our key objectives is about partnerships. Just think about how we are going to need to work with primary care, with GPs, with practice nurses, with mental health, working with physical health, with older people services who are working with working aged adult services, with social care, with voluntary sector, with the third sector, with families, with patients, co-constructing, co-designing. It all is about us working with people to deliver best outcomes. And we need to plan those services which is around people, their families, and their communities. Yeah. I want LPT to be a great place to work, where we have a culture of continuous improvement. We come back to that financial challenge. Well, all we can do is live within our means. We need to focus on doing the best we can do with every pound that we have to spend. I could lose lots and lots of sleep, and occasionally I do lose little bits of sleep about money and finances and how we deliver the quality that we want to without all the money that we have. But actually, we can't do anything about that. In the last staff survey of this trust, only about 50% of the trust said they worked in effective teams. We can do better than that. Yeah. Set yourself objectives. Talk about how you work together. We can improve that. And we can improve it by getting a sense of belonging. Now we're setting up a whole series of programs, some of them are ongoing, some of them you can see a theme in the way that they're branded. We want to be more innovative, we create. We want, and there is a training program now to support improvement and continuous quality improvement, we improve. We've got a talent management process set up, we nurture. Citizen hasn't been launched yet, but it will be, and it's about our response to our corporate social responsibility as an organisation. What are we going to give back to our community? I've relaunched the charity Raising Health. It's our charity, it's our community and mental health charity. And I hope some of you will engage with raising money over the coming years for that charity, because that money goes directly to care for you and to care for our patients, and that's what we want to achieve. So thank you very much.